Good morning, ladies and gentlemen. In the next few minutes, I would like to introduce my 3 months progress. My name is Dorina Bajzát. I graduated at University of Debrecen 3 months ago as a medical doctor. Today, I'm a first-year PhD student at Center for Translational Medicine, and I'm working at HUPIR National Pediatric Institute. My mission is a better quality of life of children with inflammatory bowel disease. Good timing and good methods of surgical interventions are essential for this. So my vision is to assess the current situation of surgical interventions and improve the quality by communicating the results. Please let me introduce my 2 ongoing projects about the connection of biologic therapies and surgical interventions in the pediatric inflammatory bowel disease. The title of my first project is the association between preoperative anti-TNF-alpha therapy and postoperative complications in pediatric IBD. According to publications, anti-TNF-alpha increases the risk of infection. The use of biologics before surgery is controversial. However, the most recent meta-analysis in the adult population didn't find any differences between the occurrence of complications in the group of patients who were treated with infliximab or not. In spite of this, the pediatric surgical guideline still recommends that anti-TNF-alpha administration during immediate perioperative period is discouraged, as it is associated with an increased risk of infection. So that's the reason why we would like to analyze this question, and our aim is to assess the safety of preoperative anti-TNF-alpha therapy within the washout period in pediatric IBD. In this slide, you can see our clinical question. Is it safe to operate the patient received anti-TNF-alpha within 12 weeks or wait for the washout? The population of the study is children with inflammatory bowel disease and intestinal resection. The intervention is preoperative anti-TNF-alpha therapy within 12 weeks, while the comparison is no preoperative anti-TNF-alpha therapy within 12 weeks. The outcome is the postoperative complication. We would like to divide the outcomes into 5 groups: infectious and non-infectious complications, readmission, reoperation, and length of hospitalization. The result of the meta-analysis will help the physician to schedule the operation. Here you can see our final search key, and with this search key, we found almost 5,000 articles. After the title and abstract selection, we have 97 eligible studies. The full text selection is in progress. At the second part of my presentation, please let me introduce my second project, which title is Intestinal Resections in Pediatric Crohn's Disease, a nationwide survey based on the Hungarian Pediatric IBD Registry. The 5- and 10-year risk of intestinal resection are 25% and 35%. According to publications, the risk of surgery is associated with complicated disease behavior, antibody positivity, and disease location. But there are conflicting data on induction early azathioprine or anti-TNF-alpha therapy. Furthermore, we haven't got any information about the Hungarian surgical interventions. However, it's important for the low-income countries. So our aim is to analyze the frequency and practice of surgical interventions in pediatric Crohn's disease based on the Hungarian Pediatric IBD Registry. Moreover, we would like to analyze the association between early azathioprine and/or anti-TNF-alpha therapy and the first surgery. The Hungarian Pediatric Registry is an existing, prospective, and nationwide registry with 27 centers and 45 pediatric gastroenterologists. The number of the patients in the registry today is more than 2,200 children. With this flowchart, I would like to show you the follow-up system of the registry. We use electronic-based forms to collect the data. With A form, we enroll the patient into the registry, while the B form belongs to the follow-up visits. As you can see here, we have some information about the surgeries during the follow-up. But actually, it means we know some data about the time of the surgery and the type of the surgery, but nothing else. We didn't know anything about the methods of the surgery, the complications, or something else. So that was one of the reasons why we started this project. And firstly, we identified the patients who underwent any types of intestinal resections between 2010 and 2019 connected to their IBD. After that, we built up and sent out a questionnaire. It was filled by pediatric gastroenterologists. Moreover, we also received the surgical descriptions. The clinical question is the following. Is there any association between early azathioprine and/or anti-TNF-alpha therapy and the risk of intestinal resection? The population is children diagnosed with Crohn's disease. The exposure is azathioprine and/or anti-TNF-alpha therapy within 3 months after diagnosis, while the comparison is no azathioprine and/or anti-TNF-alpha within 3 months after diagnosis. The outcome is the intestinal resection. We believe it's an important topic because those who have high risk for surgery at diagnosis, early azathioprine and anti-TNF-alpha should be recommended. We will include children under the age of 18 who were diagnosed with Crohn's disease, but we would like to exclude adult patients, those who were diagnosed with ulcerative colitis or unclassified IBD, or perianal disease and underwent oncotomy, ceton drainage, or fistulectomy, and intra-abdominal abscess. This is just a short overview of my 2 projects. We plan to submit the 2 projects at the end of March and at the end of May. Thank you for your kind attention. And my favorite quote is, never measure the height of a mountain until you have reached the top. Then you will see how low it was. Thank you so much, and I'm ready for the questions.
And how many patients in the registry did surgical intervention? How many questionnaires you sent out and how many questionnaires you got back? So what is the percentage of success?
The percentage of success is 93% today. But there are some missing questionnaires, and we hope we will collect these.
And how many patients altogether with surgical intervention?
As I remember good, it was a little more than 160. Thank you so much.